Hello and welcome to the overview of internal medicine. Here we will be learning the functions of the department, the team players in this department, how time can be managed well while training in this department, the roles and responsibilities of a house officer in the Department of Internal Medicine, the expectations of being a house officer here, and last but not least, the pathway to specialize in this field for those of you who might be interested to understand the journey or maybe live one. Let's get started. The Department of Internal Medicine forms the core of all departments in a hospital. There are various departments under the umbrella of the Department of Internal Medicine, such as cardiology, respiratory medicine, oncology, hematology, and many more. The objectives of the Department of Medicine in the management of ward patients include establishing a diagnosis, treating the underlying medical condition diagnosed, communicating with patients and family members on their progress and future plans, and also preparing discharge plans and follow-ups in the clinics. Let's dive into the function of the department. The department deals with adult medical conditions which do not involve any surgical procedures. Common conditions which are seen in this department include diabetes mellitus, high blood pressure, heart diseases, rheumatism, asthma, and many more. The main role of this department is to diagnose, treat appropriately, and establish the patient on the road to recovery if possible. This involves seeing the patient either as an outpatient in the specialist clinic or managing him or her as an inpatient in the wards. There are numerous staff and service providers working together in the medical team to ensure the objectives of the department are met. It is advisable to be well aware of who your team comprises and what are their respective roles as part of the medical team. Let's take a look at the team of the doctors. The medical team in the ward is led by a consultant of the ward, followed by specialists, medical officers, and finally you, one of the many house officers. So it is advised that you introduce yourself to the ward team on your first day in the ward. The department head is usually a senior consultant. However, many hospitals in the country have department heads who are young specialists. The HOD runs the department, essentially looking into the financial needs, resource needs, and overseeing the day-to-day activity of the department. They also play an important role as a representative of the department to important meetings, raise issues to the attention of the hospital director, and manage the department's budget to ensure adequate medications and equipment are available. The ward consultant leads ward rounds at least once a week. The consultant oversees the patient's diagnosis, investigations, and treatment plans. He or she also troubleshoots difficult medical problems. Then come the specialist. The ward specialist does rounds on a daily basis. He or she leads a team of doctors during the rounds. The specialist puts together the data presented to him or her and makes a reasonable clinical diagnosis. The roles also extend to ordering relevant bedside tests, lab tests, imaging studies, and procedures which form the basis of the investigative process of the patient. And finally, he or she then concludes a management plan and conveys the progress of the patients to them and their families. Next would be medical officers, who are the doctors who have completed their housemanship training. They can also perform simple procedures without specialist supervision. They oversee and supervise house officers in simple procedures. They usually start their rounds prior to the specialist rounds. Hence, the cooperation between the medical officers and the house officers is essential in ensuring patients receive holistic care during their stay in the ward. Next, let's take a look at the nursing staff. So, the nursing staff in every department is led by the matron of the department. The matrons are in charge of the nursing service division and are directly accountable for proper organization, direction, and coordination of nursing services. They are the nursing representatives of their wards to raise issues to the hospital director. They arrange and organize staffing requirements and other resources needed by the wards. Next, we have the ward sister. The ward sister organizes all nursing activities of a unit in accordance with hospital policy and rules. Ward sister also directly supervises patient care of her unit and provides direct care to seriously ill patients as and when a situation arises. He or she takes care of the well-being of the nursing staff team. They manage their rosters and also helps them carry out duties if the wards become too busy or overwhelming. She is also in charge of ensuring all the records of the patient related to diagnosis, condition and treatment and ensure proper maintenance of these records. Next would be the nurses. So the ward nurse are divided into the staff nurses and the community nurses, or also known as jururawat masyarakat. The ward nurse provides direct care to patients. They are responsible for obtaining patients' vital parameters and charting them on the observation charts. He or she will provide comfort to the patient and maintain the safety of the patient as well. Every day, one of the nurses in the ward will be assigned a medication administration trolley. He or she will be stationed by this trolley to prepare and dispense medications to patients. So you may require their assistance for patients' vital signs charting, capillary blood glucose monitoring, or even medication administration ad hoc. Next, we have the allied health professionals. These are ward pharmacists. Ward pharmacists follow the ward rounds led by the specialist or consultant and provide their consultation on the safety of therapeutics prescribed, alternative drug therapy, double checking on dosages and orders to prevent medication errors. They also provide suggestions to manage the current medication supply available in the hospital. You may require the assistance of the ward pharmacist to verify the medications ordered to prevent medication errors. Next, we have the support staff, who are the clinical assistants. They are involved in a range of duties associated with the upkeep of the ward environment, cleaning medical devices, and to maintain the highest standards of cleanliness throughout. They are also in charge of dispatching blood, urine, or stool specimens in biohazard bags from the wards to the lab counters. They also take care of patient lifting and transportation. Then we have the lab assistants. So, medical lab assistants assist physicians in the diagnosis and treatment of diseases by helping us perform tests on tissues, blood, and other body fluids. You and your ward team highly depend on lab technicians. Having a smooth relationship with them enables communication to work well to ensure specimens dispatched to the lab and processed promptly and the results are communicated back to you as per the stipulated time frame. Next would be the imagers. The imagers are also known as the radiographers. They are certified technicians who capture images of organs, bones, and tissues for patient diagnosis. Radiographers are well equipped with technological skills to handle imaging equipment and the interpersonal skills necessary for patient care. You will be coming into contact with radiographers while accompanying patients to the radiography unit. So you may need to assist them with the patient's mobility and positioning patients for imaging. Next would be the record keepers. A medical record or report is a piece of information on the history, level of health and condition of the patient who has been hospitalized and can only be provided by the medical officer or specialist of the clinical department where the patient is receiving treatment. So the record keepers here are responsible for the maintenance of medical records. They must safeguard medical records from tampering, loss, and unauthorized use. They're responsible for seeing that the patient's right to privacy and the confidentiality of the information stored within the medical record is maintained at all times. So daily documentation and completing discharge summaries are important roles you play as a house officer. Ensuring documentation is appropriate and well done can assist the record keepers to organize and store them well for record and reference purposes. We have the telephone operators. To ordinary people visiting or calling into a hospital switchboard operator seems to be doing mundane work. In actuality, these people are wholly responsible for all the communication that goes on in a hospital. You will be dependent on the operators to connect phone calls within and out of the hospital. Good communication can be ensured if you are courteous and concise with your calls. Then we have the support crews. The support crews include the housekeepers and the linen managers. The role of housekeeping in hospitals is to ensure that all areas, including treatment and surgical rooms, patient rooms, labs, as well as public areas, are kept clean and sanitized. Linen and laundry services are responsible for providing a safe, clean, adequate, and timely supply of linen to user units of a hospital at the right time. Linen managers are staff that are responsible for storage and transportation as well as disinfection of linens. So, how do you fit in with them? You and your ward members depend on the support crews as they keep your ward clean and safe from hazards. You can play your role by ensuring sharps and waste are discarded well and pose no danger to the housekeepers. Linen managers appreciate your assistance in placing the used linens in their respective bags. Let's look at the roles and responsibilities you play. So, for the role of establishing a diagnosis, you are important in carrying out plans ordered by the physician to arrive at the diagnosis. It begins with the admission clerking, which is essential to gather patients' presenting history, followed by performing bedside tests like ECG, peak flow test, capillary blood glucose test, and arterial blood gas sampling. Next would be sampling for lab investigations via venipuncture, blood culture procedure, peripheral blood film, and blood film for malarial parasites. Once tests are sent, the results are traced based on the orders made. As for treatment and management is concerned, you can provide symptom relief and assist with supportive care by inserting a nasogastric tube or urinary catheters. You also participate in making appropriate referrals to the relevant departments as ordered by the physician to request for their assessments. And finally, you assist in blood product collection from the blood bank, which is required for urgent transfusion. When it comes to communication, you are not expected to break bad news directly or convey the diagnosis to the patient or family if uncertain. Always get your senior to handle patient-family conferences in order to avoid miscommunication. How about when the patient is about to be discharged following a treatment course in the ward? You will be in charge of doing the discharge summary and ordering the discharge medications, which will be counter-checked by the attending medical officer. Next, let's get into the interesting part, which is time management. Time management is extremely crucial to reap the maximum benefit of training during your housemanship. This looks at a few general tips on how you could organize your task and use your time wisely. Tip number 1. Create a job list or a task list. Make a customized table to summarize your ward works and tasks systematically. Prioritize work that needs to be done within office hours, such as requesting imaging or requesting any special bloods which needs specialist authorizations and non-urgent referrals. Cross out tasks that had to be carried out to avoid confusion between colleagues. And delegate your task among your colleagues, such as blood taking, referrals, requesting imaging, and assisting in procedures in order to ensure that everything gets completed within the stipulated time. Tip number 2, familiarize with your patients and their surroundings. Always allocate enough time to review your patients. Remember the important things about your patients and their significant results. Check the necessary parameters and attachments on your patient, such as wound dressings, vital signs, and medications. And importantly, save the necessary emergency contact information for the day, such as your medical officer or specialist in charge or on call, as here in Malaysia, we do not have a pager system. The next tip is take turns with your colleagues if you wish to take a break and notify your team members or senior colleagues on your whereabouts to ensure miscommunication is avoided. Be early to reconfirm your patient's cases before the rounds begin. Prepare a template on your presenting complaints. Prepare a template for progress reviews and case presentations to be on top of the game. Finally, use electronic or digital productivity tools which most of you might already have in your daily usage devices such as your smartphones, iPads, or a digital notepad. Utilizing the reminder, notification, and planner apps or systems can not only save your time, but also ensures tasks are completed. In the medical department, you will be the first person before any of your medical officers or specialists to encounter the patient in the ward. So, your role as a house officer is to assist your medical officer and specialist with carrying out initial assessments of the patient. Here, you will need to be smart in prioritization. Next, you will need to learn how to document thoroughly to avoid miscommunication or misinterpretation of information. In this department, you're also expected to have great communication skills because you will need to be communicating with your team in order to complete your job task, as well as communicating conditions and situations to patients and their family members. And finally, you will be superb at your teamwork if you take that out. Finally, remember that working in the medical department requires cooperation from everyone in the department, and you have a shared responsibility with everyone else towards your patients. Now, as you progress through this specialty, you find yourself having an interest in this field and plan to specialize in it. Upon completion of your housemanship training, you can then proceed on being a medical officer. In fact, your training can actually begin as early as during your housemanship years. As you begin your journey, you will have to first determine the pathway that you are interested in. There are 3 ways as shown in this slide to cater for different categories of applicants. For those of you who are working with the Ministry of Health, they can apply to join the Master of Medicine program or the parallel pathway. The difference between these two is the qualifying examinations. Masters in Medicine requires the Internal Medicine Entrance Examination or IMEE, or one can have Part 1 MRCP. The examination is conducted at least once a year and can be taken as early as 6 months into housemanship. A pass in the entrance examination is valid for 3 years. Eligible applicants can then apply for scholarships from the Ministry of Health Postgraduate Training Division. While awaiting confirmation of their scholarship application, they must apply directly to the Ministry of Education to enter the Master's Training Program. There will be an interview before the final selection is made. Alternatively, one can opt for the parallel pathway training and remain in his or her usual place of work with attendance to various rotations as stipulated by the training requirements. He or she must also have completed Part 1 MRCP examination and register with Bahagian Perkembangan Latihan. One will then need to complete the written examination, which is Part 2B, and the practical examination, which is also known as PACES. Another approach is to apply as a private candidate for the master's program directly to the universities which offer the programs through their postgraduate studies office. The training will be fully paid by the candidate applying for the program. You may find more details on this on the respective university's website. Finally, as you are into the program, it will spend 4 years with regular workplace-based assessments and tasks to be supervised by the designated supervisors. Reports will be generated throughout the training, which will be submitted to the exit committee. Upon completion, one can then undergo gazettement training under the supervision of Ministry of Health or Ministry of Education trainers. Finally, as you are into the program, it will spend 4 years with regular workplace-based assessments and tasks to be supervised by designated supervisors. Reports will be generated throughout the training, which will be submitted to the exit committee. Upon completion, one can then undergo gazettement training under the supervision of Ministry of Health or Ministry of Education trainers. Following 6 months of gazettement, training is officially complete, and one can then pursue to apply for their National Specialist Registration 1 year post-gazettement. This is the list of recognized postgraduate qualifications in Malaysia. These are the local and overseas programs that are recognized postgraduate qualifications to practice as a registered physician in Malaysia. You may find this list on the Malaysian National Specialist Registry website. Further subspecialization pathways which can be considered include the recognized pathway via Ministry of Health, which lasts for 3 years and can be applied after 2 years post-general specialization. An alternative pathway to obtain this is through a short period of attachment, which is usually for 6 months to 1 year at any relevant place overseas. Finally, the subspecialties in internal medicine. We have cardiology, hematology, gastroenterology or hepatology, infectious diseases, oncology, immunology, palliative care, nephrology, respiratory medicine, neurology, geriatrics medicine, endocrinology, and rheumatology. So in summary, we have looked at what does this department essentially deal with, who are the essential team players that make this department, the simple tips on how time can be managed well while training in this department, understanding the roles and responsibilities of a house officer in the Department of Internal Medicine, what is expected out of you while you are on duty as a house officer here, and the pathway to specialize in this field upon completion of housemanship training for those of you who are keen to join this field of medicine. There are plenty of online resources available to assist with your learning process while you are in training as a house officer in the internal medicine department. You are encouraged to be resourceful as it makes your job easier. Here, we will be going through some useful resources to aid your quest for department-related information and skills training. The National Institute for Health and Care Excellence, or NICE, provides up-to-date guidelines and the best practice standards for multiple disciplines in medicine. They are evidence-based recommendations for health and care in the relevant fields of medicine in England. The Academy of Medicine was founded in Singapore in 1957 to assure the maintenance of a high standard of professional and ethical practice. Now we have the Academy in Malaysia. Here you are able to get access to clinical practice guidelines for reference and the latest newsletters from the Academy. The New England Journal of Medicine is a weekly medical journal published by the Massachusetts Medical Society. It is among the most prestigious peer-reviewed medical journals as well as the oldest continuously published one. Next would be Geeky Medics Medicine Notes. So it is a part of a compendium of a comprehensive collection of visuals, notes, flashcards, and many more interesting learning tools online for the Department of Internal Medicine. Geeky Medics has an extensive compilation of clinical skills videos to assist doctors in training with their learning. Next, we have BMJ Best Practice, or also stands for the British Medical Journal Best Practice, which is an online decision support tool for use at the point of care. Bringing together regularly updated research evidence with the knowledge of international experts, this best practice guideline offers a step-by-step approach to help manage patient diagnosis, prognosis, treatment, and prevention. For you all audio learners, we have the Curbsiders podcast. The Curbsiders is an internal medicine podcast in which 3 board-certified internists interview experts on clinically important topics. In a collaboration with Medscape, the Curbsiders share clinical pearls and practice-changing knowledge from selected podcasts. Well, here we have also compiled a list of YouTube channels which have stunning presentation of medical education to assist you in your training. Here, Dr. Armando is a popular online medical educator who enjoys art and science. He successfully transformed the complexities of science and medicine into art. Do check out his channel. Then we have Strong Medicine. Strong Medicine is another great channel for videos on medical topics. Its host, Eric Strong, is a clinical associate professor of medicine at Stanford University's School of Medicine. The vlog is followed by people from all around the world, and the content is not explicitly educational only. It covers various areas from personal experiences to tips and tricks for current students and explanatory lectures. As the name of this channel suggests, it contains 1-minute educational videos on various medical topics. The host, who is Dr. Rob Tarswell, answers a range of health, medical, and biology related questions, providing simple explanations and avoiding medical jargons. Another great medical YouTube channel to follow is Healthcare Triage. It is hosted by Dr. Aaron Tharol, Professor of Pediatrics and Associate Dean for Research Mentoring at Indiana University School of Medicine. In his videos, he explains healthcare policies, medical research, and answers various questions people might have about medicine, health, and healthcare. Dr. Najib is among the most popular medical lecturers online. He publishes new videos on basic medical sciences and clinical medicine every week. An extension to his complete video library, Dr. Najib's YouTube channel features a selection of free sample videos on a vast array of topics, among which pathology, physiology, immunology are covered. One of the most popular medical channels on YouTube trending today, Osmosis, shares in-depth explanations on a range of medical topics. Osmosis is also an extension page of its online learning platform, which focuses on more in-depth videos for health professionals and students. If you're looking for a YouTube channel to help you prepare for upcoming exams or exit exams from your rotation, you've come to the right place. Founded in 2012, MedCram Videos is ranked as one of the most popular medical YouTube channels. Khan Academy Medicine is a popular YouTube channel providing a world-class education for anyone, anywhere. The featured videos would be a valuable learning tool for every healthcare professional as well as medical students around the globe. Lecturio Medical is a medical channel that publishes various video lecture series presented by experts every week. Lecturio Medical states that their goal is helping students worldwide score high on their medical board exams as well as assist healthcare professionals in their clinical practice. Well, we have finally come to the end of this session on the overview of the Department of Internal Medicine. We hope it was insightful and stay on for the next sessions with us. Thank you.